Wald was the first public health nurse in the country. She advocated for equal treatment of women, worked against child labor, and worked to provide quality health care for immigrants living in the tenements in New York City's Lower East Side. The Civil War was a period of reform for the nursing practice. This period, as stated by Zerweck, witnessed an improvement in patient care through control of the environment in which the patient recovered. Zerweck also explains that it was in this era that the value of primary prevention, or the prevention of the occurrence of disease by measures such as immunization and the provision of a pure water supply, became understood. Lillian Wald was born to Max and Minnie Schwartz Wald immediately following the Civil War on March 10, 1867 in Cincinnati, Ohio. The family finally settled in Rochester, New York in 1878, and this is the town that Wald considered home. When she was only 11 years old, she met a young nurse who inspired her to study nursing at New York City Hospital. She graduated when she was 22 and entered Women's Medical College to study to become a doctor. Shortly after she began taking classes as a medical student, Wald accepted an invitation to work with immigrant families on the Lower East Side. Zerweck states during the Victorian era, nurses generally were women who wanted to avoid the drudgery of a Victorian marriage. It was important that these women were single so they could commit themselves completely to the nursing vocation. Nurses during this time were expected to be submissive and hardworking. Zerweck also states that it was the physician who generated the income, and patients were only likely to be admitted to the hospital if they were able to pay for their care. Lillian Wald was an influential person in reforming these ideals during the Victorian era. During this time period, the tenements were largely prominent, located mainly in New York's Lower East Side. They were sites of overcrowded, narrow apartments where many immigrants had come to find a better life. Many of the establishment's living conditions were dangerous and unsafe because they lacked indoor plumbing, were dimly lit, and crowded. An article by the Jewish Women's Archive states the overcrowded, poorly lit, and ventilated tenements of the Lower East Side were once home to hundreds of thousands of recent immigrants. In the late 19th century, many of the apartments in these tenements doubled as garment workshops. While organizing a class for in-home nursing, a child came to her and pleaded for Wald's help. The child led her to her mother in a dilapidated home where she had been hemorrhaging blood since giving birth 2 days earlier. Wald cared for the woman, comforted the family, and cleaned the bed and room where the woman had been. This event inspired Wald and a colleague to establish a presence on the Lower East Side, obtaining financial and government support for their mission. By 1895, their presence had moved to a larger establishment located at a facility on Henry Street. An article by the Visiting Nurse Service of New York states throughout her career, Wald never lost sight of the fact that the health of the community affected the health of the individual. In particular, she sought to improve the lives of women, children, and recent immigrants. Wald's goal was to improve working conditions for women by establishing a minimum wage. She also helped place nurses in public schools and worked against child labor. Although the Henry Street settlement was the first and best known, other establishments were opened throughout the New York area in which healthcare was provided, community programs were established, and people were assisted with gaining employment, regardless of race or ethnicity. An article by the Social Welfare History Project explains Wald made the Henry Street settlement available as the meeting place for the National Negro Conference, which became the National Association for the Advancement of Colored People. Lillian Wald and her colleague became the first public health nurses in the country through caring for neighbors' illnesses and assisting with births and deaths. She made drastic improvements to the health of many and initiated many of the advancements in equality for women and treatment of children. An important advocate for women, Wald worked to secure women's voting rights and supported her colleague Margaret Sanger in her fight to give women the right to birth control. She also had much influence on education for children and nursing students alike. According to an article by Social Welfare History, Wald persuaded Columbia University to appoint the first professor of nursing at a U.S. college. Until that time, nursing had been taught in hospitals and consisted largely of supervised work experience. Thanks to Wald, nursing education now takes place in universities, augmented by practical experience in a teaching hospital. In an article by Vance, Lillian Wald is quoted in saying, "Over broken asphalt, over dirty mattresses and heaps of refuse we went. I felt ashamed of being a part of society that permitted such conditions to exist. What I had seen had shown me where my path lay." Lillian Wald quickly found her passion in life, and it is obvious through her accomplishments. Wald laid the groundwork for what nurses should aspire to be and made a huge impact on healthcare through looking at healthcare as a right rather than a privilege.